Hey everyone, Rita here, and if you're watching this with a stuffy nose, pressure sitting right behind your cheekbones, or that dull ache that creeps up your forehead every time you bend over to tie your shoes, I want you to stop scrolling for the next few minutes because what I'm about to show you might genuinely surprise you. We're not talking about another spray. We're not talking about another pill you have to remember to take every 4 hours, or a neti pot you have to fill with lukewarm saline and awkwardly tilt your head over the sink for. What I'm going to walk you through today is something almost nobody in the wellness space is actually teaching properly. A hands-on technique that works directly with your body's own drainage pathways and nervous system reflexes to open up congestion, often within seconds. Not hours, not days, seconds. I know that sounds like a big promise. So let's slow down for a second and actually understand why your sinuses get so miserable in the first place. Because once you understand the why, the technique itself is going to make so much more sense and you'll actually trust it enough to use it. Why your face feels like it's under pressure. Every single day, your nose and sinuses are working as a filtration system. Think of them as the security checkpoint for everything you breathe in: dust, pollen, bacteria, viruses, mold spores, pet dander, whatever's floating around in the air. Your body wraps all of that in mucus and tries to move it along and out. Most of the time, this happens quietly in the background and you never even notice it. But here's the problem. When you're dealing with allergies, a cold, a sinus infection, or even just a sudden change in weather or humidity, the lining inside your sinuses gets inflamed and swollen. That swelling narrows the tiny openings. We call them ostia, that are supposed to let mucus drain freely into your nasal passages. When those openings get blocked, mucus backs up, it pools, it sits there. And that trapped fluid is exactly what creates that heavy, pressurized, my face weighs 40 pounds feeling. Now here's something most people never learn. You don't actually have one sinus. You have 4 sets of paired air-filled cavities in your skull, and they're all interconnected like a little network of rooms with doors between them. The ethmoid sinuses tucked between your eyes near the bridge of your nose, the sphenoid sinuses deeper inside your skull behind your eyes, the frontal sinuses sitting right above your eyebrows in your forehead, the maxillary sinuses, the largest of the 4, positioned behind your cheekbones. Here's the part that matters most for what we're doing today. The majority of the congestion, pressure, and pain that people experience shows up specifically in 2 of these: the maxillary sinuses behind your cheeks and the frontal sinuses in your forehead. That's why when your sinuses are acting up, you feel it right in your cheekbones and right above your eyebrows. That's not a coincidence. That's anatomy. The part nobody talks about. Your ears are in on this too. Now here's where this gets really interesting, and it's the piece that I think gets left out of almost every sinus tutorial online. Your sinuses aren't operating in isolation. They're wired into a whole regional network that includes your ears, specifically through something called the eustachian tube. This is a narrow little passageway that runs from the back of your nasal cavity all the way to your middle ear. Its job is to equalize pressure and let fluid drain out of the ear space. You felt it working before, that pop your ears do on an airplane, or when you yawn or swallow hard. That's your eustachian tube opening and closing. When your sinuses get congested, that inflammation doesn't politely stay in one lane. It spreads. It can travel right up into that eustachian tube and block it too. And when the eustachian tube gets blocked, you're not just dealing with a stuffy nose anymore. Now you might notice a strange clicking sound when you swallow, a persistent ringing in your ears, what's medically called tinnitus, a muffled or underwater feeling, or even bouts of dizziness and lightheadedness, which we call vertigo. This is why so many people go to bed with a stuffy nose and wake up with an earache too, or why sinus pressure sometimes comes with a spinning room sensation that makes absolutely no sense to them. It's all connected. It's one system, not 4 separate problems. So if we really want to give your sinuses fast, meaningful relief, we can't just focus on the nose. We need to address the cheekbone region, We need to release tension around the ear canal to reopen that eustachian tube pathway, and we need to trigger a reflex that tells your brain to kick your natural drainage system into gear. That's exactly what this technique is built to do. What you're about to learn, I want to be upfront with you. This is not a substitute for medical care if you have a serious or chronic sinus condition, a diagnosed sinus infection that needs antibiotics, or a structural issue like a deviated septum or nasal polyps. If your symptoms are severe, persistent for more than 10 days, come with a high fever, or involve facial swelling, please see a doctor. This technique is meant to be a fast, natural, drug-free tool you can use alongside good medical guidance, not a replacement for it. With that said, for everyday congestion, seasonal allergies, that first cold of the season, or just waking up puffy and stuffed up from dry indoor air, this is one of the fastest natural resets I know of. Let's get into it. Step 1, releasing the maxillary sinus and reopening the eustachian tube. We're going to start on one side of your face at a time because you want to give each side your full attention rather than rushing through both simultaneously. Take your right thumb and place it right underneath your right cheekbone. You're aiming for that little hollow area, the soft tissue just below the bony ridge of the zygomatic bone. This is essentially the front wall of your maxillary sinus, and there's a reason we're targeting it directly instead of just rubbing your whole face randomly. Once your thumb is positioned there, apply gentle but firm pressure and start a slow pumping motion, pressing in and then releasing out. You're not jabbing at your face. Think of it more like you're gently coaxing that tissue to move, almost like you're helping to physically encourage the fluid trapped behind it to start shifting and draining. While your right thumb keeps that steady in and out rhythm, bring your other hand up to your right ear. Take hold of the lower part of your ear, the earlobe and the fleshy lower portion, and pull it firmly straight outward and slightly downward away from your head. Hold that pull. Don't let go. Why does this matter? Pulling on the ear like this creates gentle traction on the surrounding tissue and cartilage, and it can help mechanically encourage that eustachian tube to open back up, especially when it's paired with the pumping motion at the cheekbone. You're essentially working both ends of the same drainage pathway at the same time. Hold this combined position, thumb pumping under the cheekbone, ear pulled straight out, for a full 10 seconds. Don't rush it. Count it out slowly in your head. Most people start to feel a shift before they even reach 10 eyes, a kind of release, a loosening, sometimes an actual sensation of fluid moving. Now switch sides. Take your left thumb and place it underneath your left cheekbone this time, using that same gentle pumping motion, pressing in and releasing out. Bring your other hand to your left ear, take hold of the lower portion and pull it straight outward, holding that traction steady. Hold this for another 10 seconds. Breathe normally while you do it. Don't hold your breath yet. That part comes next. Just stay relaxed, let your shoulders drop, and let the technique do its work. Once you release both sides, pay attention to what you're feeling. Most people notice some kind of drainage sensation almost immediately. Sometimes it's an actual drip at the back of the throat. Sometimes it's a lightness in the face. Sometimes it's that satisfying pop of pressure releasing, similar to what you feel when a plane starts its descent. Whatever you feel, that's a good sign. That's your body responding. Step 2, the nasal reflex and breath hold. Now we move to the second half of this technique, and this is the part that genuinely surprises people the first time they try it, because it feels almost too simple to work as well as it does. Take your fingers, thumb and index finger work best, and gently pinch your nose shut, sealing off both nostrils completely. Take a slow, deep breath in through your mouth, filling your lungs as much as comfortably possible. Once your lungs are full, gently tilt your head back, looking upward toward the ceiling, and hold your breath. Keep your nose pinched shut the entire time. Hold that breath for as long as you comfortably can. You're not trying to set an endurance record here. Just hold it a bit longer than feels automatic, right up to the point where your body is genuinely asking you to breathe. Here's what's actually happening physiologically while you do this. Holding your breath with your head tilted back and your nose sealed changes the internal pressure dynamics in your nasal cavity and sinus passages. It also engages a reflex pathway that runs between your nasal tissue and your brainstem, part of your body's autonomic nervous system, the same system responsible for things like your heart rate and digestion that you don't consciously control. This reflex, when triggered this way, sends a signal back down to the sinus and nasal tissue that essentially tells it to relax, dilate, and open up. When you genuinely can't hold it any longer, let go of your nose and exhale forcefully through it. Really push that air out through both nostrils in one strong burst as you bring your head back down to a neutral position. Then take a slow, deliberate breath back in through your nose. That's it. That's the full sequence. What you should notice. For most people, the change is immediate and honestly a little startling the first time. Your nasal passages feel more open. Breathing feels easier and quieter. No more of that whistling half-blocked sound. Any pressure sitting behind your cheeks or across your forehead often noticeably softens. Some people feel actual mucus draining down the back of their throat within moments of finishing the sequence, which, while not the most glamorous sensation in the world, is a genuinely good sign that things are moving the way they should. If you don't feel a dramatic change the very first time, don't worry and don't give up on it. Like most techniques involving muscle memory and reflex pathways, your body often responds more and more effectively the more familiar it becomes with what you're asking it to do. Give yourself 2 or 3 rounds, spaced a few minutes apart, especially if your congestion is significant. Making this part of your routine and what to pair it with. Here's something I really want you to walk away with, because a lot of creators show you a technique like this and then just leave you there. I don't want to do that. I want you to actually get lasting relief, not just a temporary fix you forget about by tomorrow. Hydration is doing more work than you think. Mucus needs water to stay thin and flow freely. When you're even mildly dehydrated, your mucus thickens up, gets stickier, and clogs those little drainage openings even more stubbornly. Before and after doing this technique, drink a full glass of water. Warm water or herbal tea is even better, because the warmth itself can help relax nasal tissue. Humidity is your sinus's best friend. Dry indoor air, especially in winter when the heat is blasting, or in air-conditioned environments in summer, dries out the delicate lining of your nasal passages, making them more prone to irritation and blockage. If you deal with chronic congestion, running a humidifier in your bedroom overnight can make a noticeable difference over just a few nights. Warmth helps loosen things up before you even start. Try placing a warm, damp washcloth over your cheeks and the bridge of your nose for 2 or 3 minutes before doing this technique. The warmth increases blood flow to the area and can help loosen thickened mucus, making the drainage technique itself even more effective. Watch what you eat close to bedtime if congestion is a recurring issue for you. Some people find that dairy products in particular seem to thicken mucus consistency for them, making morning congestion worse. This affects people differently, so pay attention to your own patterns rather than assuming it applies to you. But it's worth tracking for a week or 2 if you're a frequent sufferer. Elevate your head while you sleep. Lying completely flat allows mucus to pool in the sinuses overnight instead of draining, which is a huge reason so many people wake up more congested than when they went to bed. An extra pillow or a slight incline on your mattress can make mornings noticeably easier. Pay attention to your environment, not just your symptoms. If your congestion flares up seasonally, or specifically indoors versus outdoors, that's valuable information. It might point toward pollen, dust mites, mold, or pet dander as the actual root trigger, meaning that alongside using this technique for fast relief, addressing your air filtration, washing bedding more frequently in hot water, or vacuuming with a HEPA filter could meaningfully reduce how often you need relief in the first place. Common mistakes that quietly ruin this technique. I've watched enough people try hands-on techniques like this to know exactly where things tend to go wrong, so let's fix those mistakes before you even make them. Mistake 1, pressing too hard, too fast. There's a temptation to think that more pressure equals more results. It doesn't. Your sinus tissue is delicate, and aggressive jabbing can actually cause more inflammation, not less. The pumping motion under the cheekbone should feel like a firm, rhythmic massage, never sharp, never painful. If it hurts, you're pressing too hard or in the wrong spot. Mistake 2, rushing the ear pull. People tend to give the ear a quick yank and let go within a second or two, then wonder why nothing happened. The traction needs to be sustained. That full 10-second hold is doing the actual work of encouraging the eustachian tube to release. A quick tug barely registers with your body. Mistake 3, holding the breath through gritted teeth and tense shoulders. The breath hold portion works best when your body stays relatively relaxed. If you're clenching your jaw, tensing your neck, and white-knuckling through it, you're actually working against the reflex you're trying to trigger. Try to stay as loose as possible while your head is tilted back. Think calm determination, not panic. Mistake 4, only doing it once and expecting a full cure. This technique is fantastic for fast, in-the-moment relief, and many people do feel dramatic results the very first time. But if you're dealing with congestion that's built up over days, one round might only get you partway there. Treat it the way you'd treat stretching a tight muscle. Sometimes one round loosens things up, and a second or third round later in the day finishes the job. Mistake 5, ignoring your posture during the day. If you spend hours hunched over a desk or looking down at your phone, that posture actually restricts drainage pathways in your neck and upper chest, making it harder for sinus fluid to move the way it's supposed to. Sitting upright with your shoulders back for even part of your day can meaningfully support what you're doing with this technique. Understanding why this actually works, the bigger picture. I think it's worth taking a step back here because I don't just want you to memorize a sequence of hand movements. I want you to actually understand your own body well enough that you could explain this to someone else. Your sinuses, your ears, and your nasal passages are lined with something called mucous membrane, a soft, moist tissue that's absolutely packed with tiny blood vessels. This tissue is incredibly responsive to touch, temperature, and pressure changes, which is exactly why physical techniques like this one can create such a fast response, compared to something like an oral medication that has to travel through your entire digestive system before it ever reaches the area that's actually bothering you. When you apply gentle, rhythmic pressure at the cheekbone, you're mechanically encouraging movement in tissue that's otherwise sitting stagnant and swollen. When you add traction at the ear, you're working with the physical structure of the eustachian tube itself. And when you combine that with the breath hold reflex, you're recruiting your nervous system to reinforce what your hands just did, essentially getting your brain and your body to agree that it's time to open things back up. This is also why so many people describe the sensation as almost immediate. You're not waiting for a chemical compound to be absorbed and metabolized. You're working directly with the mechanical and neurological systems that were designed to manage exactly this kind of congestion in the first place. Your body already knows how to do this. Sometimes it just needs a little outside encouragement to get the process moving again, especially when inflammation has things temporarily stuck. A few important safety notes. I care about you actually feeling better, not just watching a video that sounds impressive. So a few honest notes before you go try this. If you have a current ear infection, a perforated or ruptured eardrum, have recently had ear or sinus surgery, or wear hearing aids with sensitive components, skip the ear pulling portion of this technique and check with your doctor first. If you have any cardiovascular conditions, uncontrolled high blood pressure, or a history of fainting, be cautious and gentle with the breath hold portion. Never push yourself to the point of discomfort, dizziness, or straining. This should always feel controlled, never forced. And again, if your congestion comes with a high fever, thick discolored discharge lasting more than 10 days, severe facial pain, or swelling around your eyes, that's your body telling you it's time to see a healthcare provider, not just a technique to try at home. What I love about this approach is that it puts real, usable relief directly in your hands, literally. You don't need a prescription. You don't need to run to the pharmacy at 11 o'clock at night because you can't breathe through your nose lying in bed. You don't need to wait for a spray to kick in, hoping it works before you have to be somewhere in 20 minutes. You just need your own 2 hands, about 60 seconds, and an understanding of how your sinuses, your ears, and your nervous system are actually working together as one connected system, not as separate, unrelated problems. That understanding is the real gift here. Once you know how your body's drainage pathways actually function, you stop feeling helpless every time congestion hits, and you start feeling like you actually have a tool that works with your body instead of against it. So here's what I want you to do. The next time you feel that pressure building behind your cheeks, across your forehead, that stuffy, can't breathe through your nose feeling, come back to this. Do the cheekbone pump and ear pull on both sides. Follow it with the nasal pinch and breath hold. Give it a couple of rounds if you need to. And pair it with the small daily habits we talked about: hydration, humidity, warmth, and sleep position. So you're not just treating the symptom every time, but actually reducing how often it shows up in the first place. You can do this technique as often as you need to throughout the day. There's no strict limit. Your body will tell you when it's had enough relief for the moment. If this helped you breathe a little easier today, do me a favor and share it with someone in your life who's constantly complaining about their sinuses, because chances are they've never been shown this before. Drop a comment below and let me know how it worked for you. I genuinely read every single one, and hearing your experiences helps me know what to cover next. I'm Rita, and I'll see you in the next one. Until then, take care of yourself and make it a great day.